Since the lifting of the circuit breaker some 1.5 months ago, the number of community cases has increased but continued to remain low, at about an average of 12 per day. In the past week, this is similar to the number in the first week of July. But this is not the time to celebrate and be complacent. We are certainly not out of the woods yet. Globally, there are now more than 13 million people reported COVID-19 cases and more than 500,000 deaths associated with COVID-19. Many countries, such as the United States and Brazil, are still reporting surges in case numbers with no signs of slowing down yet. While some countries, including China and New Zealand, have largely managed to bring the outbreak under control, several others are experiencing a resurgence of cases a few weeks after lifting their strict social distancing measures. Some regions have had to reintroduce restrictions in an attempt to bring the transmission under control. There are useful lessons we can glean from their experience to avoid a similar scenario in Singapore. The Ministry of Health has reviewed these case studies and found that in many countries or regions where there had been a resurgence of cases, it was because safe management and safe distancing measures had not been adhered to. We have found that some had gone out when they are unwell and mingled in settings where many people had congregated. These include religious events, parties, and large family gatherings. In South Korea, for example, door-to-door sales resulted in 4 clusters with over 200 infected cases, and religious gatherings there resulted in more than 110 confirmed cases recently. In Tokyo, Japan, more than 300 cases have been linked to nightlife establishments. In Victoria, Australia, large school clusters have been spawned as students did not practice social distancing and participated in non-school-related social gatherings outside. In Hong Kong, there have been outbreaks at restaurants and cafes as patrons did not put on their masks after they have completed their meals. In many regions, lapses in workplace safe management measures, including workers not wearing masks, have resulted in large clusters too. Since phase 2 started, we should expect to see the number of cases rise. What is important is to detect these cases early and ring-fence them to prevent further transmissions and the formation of large clusters. The second wave is preventable if everyone plays our part.